Good afternoon, and welcome to the Brain and Behavior Research Foundation's special webinar, How to Stay Mentally Healthy During the COVID-19 Pandemic. I'm Dr. Jeff Borenstein, President and CEO of the Foundation. The Brain and Behavior Research Foundation funds the most innovative ideas in neuroscience and psychiatry to better understand the causes and develop new ways to treat brain and behavior disorders. These disorders include addiction, ADHD, anxiety, autism, bipolar disorder, borderline personality disorder, depression, eating disorders, OCD, post-traumatic stress, and schizophrenia. Since 1987, the Foundation has awarded more than $408 million to fund more than 5,900 grants to scientists around the world. One of the people most responsible for the success and impact of BBRF has been Steve Lieber, our chairman of the board. I am very sad to report that early this morning, Steve passed away. From the beginning, Steve and his late wife, Connie, have worked tirelessly with Dr. Herbert Pardis, the president of our scientific council. Dr. Pardis has joined us today for this webinar, and I would like to ask Dr. Pardis to speak. Herb?
Thank you very much, Jeff, and thank you all for being on this call. As you just heard, we have a tragic piece of news in that Steve Lieber, a giant in terms of the support of mental health research, passed away early this morning. I want to emphasize that Steve Lieber, with his partner Connie, are two of the most extraordinary people, imaginable, and have been dedicated to the success of the Brain and Behavior Research Foundation and other things as well. They have created the Lieber Institute down at Johns Hopkins, which works on basic science of psychiatric disorders. They've developed the Pardis Humanitarian Award, which takes note of people who do things in the general society of value as well as being important in mental health. Whatever he did, a father, a husband, a brother, a grandfather, an uncle, a national leader, Steve did it well. Steve continued the legacy that Connie had left, and all of our memories of him continue. Some of you may not be familiar with Connie and Steve as a couple, but they were dynamic, wonderfully loving of each other, and spectacular in terms of leading the Brain and Behavior Research Foundation and also supporting it. They made it the finest private entity for supportive research anywhere in mental health. They created, with the extraordinary partnership of the Morse family and the scientific brilliance of Danny Weinberger, this neurological basic science institute, the Lieber Institute, located at Johns Hopkins University, designed basically to uncover the very basic causes of psychiatric illness. It is almost impossible to find words of sufficient potency and appropriate recognition and appreciation of everything they did together. Steve's idea of creating the Pardis Humanitarian Award expressed his feeling that those scientists working to triumph over the scourge of mental illness and to negate the destructive impact these illnesses have on so many billions of human beings throughout the globe, people who suffer its ravages should receive the world's thundering applause in the same manner that scientists working on many other medical illnesses. In other words, those people doing science on psychiatric issues should be given major recognition, as are the scientists in all other areas of medicine. In addition, he wanted to take note of the invaluable efforts many of these people made to support the broad efforts of those who also did so much for the general welfare of so many human beings. So therefore, the notion of a humanitarian award. They put together a remarkable board of trustees to oversee the Brain and Behavior Research Foundation. They chose remarkable leaders such as Daniel Weinberger to lead the Lieber Institute and Jeff Borenstein as president of the BBRF, the Brain and Behavior Research Foundation, and a marvelously dedicated staff. They assembled a group of outstanding scientific leaders to create the Partis Humanitarian Award. While doing all this, Steve and Connie, the woman he adored and revered, were also the marvelous leaders of a family which had love and caring as its primary characteristics. So Steve and Connie adore the family, and their love permeated their relationships with countless people, not only in the mental health field, but in every aspect of their life. There are so many we want to call attention to, so many people, but central in that cast is his beloved Connie, his tragically too soon death of Sam Lieber, his son, his daughter Janice, his marvelous daughter Mary Rubin, but his grandson David, and his very special relationship with his nephew Jeff Simon. Those of us who adored Steve and Connie will do everything we can with the intent that we will continue to run these organizations in the way Steve and Connie Lieber would want us to do so. Our hope is that all of us who know them or come to know them will try their own way, in their own way, to conduct their behavior, their life, their support toward the same marvelous goals, actions, and support. Simply put, we want to assert the most powerful expression of love for these two extraordinary people. It comes from everywhere. It comes from scientists who are supported by their institutes. It comes from families who've been helped by them. It comes from patients who've been helped by them. This is one of the most remarkable efforts of a selfless, and I underscore selfless couple who wanted nothing but to help other people. And they are remarkable. And as you might imagine, all of us who know and love them suffer their loss and his loss today with great regret. It's terrible. But thank you all for being on the call. And maybe in their honor, we can do all we can to support the BBRF, the Humanitarian Award, the Lieber Institute, to make them continuing functions and functions that operate in the same way as Steve and Connie so effectively did. Thank you all very much. Thank you for being with us today.
Thank you, Herb. Thank you for your extraordinary words and for your leadership throughout. And I know how very, very much Steve loved and respected you and appreciated everything that you've done throughout the years. Everybody who knows me, thank you. Everybody who knows me knows how closely I've had the opportunity to work with Steve and how much and the level of my love and respect for him as well, and what a personal as well as professional loss this is. I've received many messages already expressing appreciation for Steve's leadership and vision, and also love and support from these people who have reached out. Those heartfelt messages really are extremely meaningful to me, and I'm so appreciative. Earlier today, we had this webinar scheduled, and we'll move forward momentarily. I was speaking with Herb about the webinar and the loss of Steve, and I said to Herb, if I could make a phone call to Steve right now and said, should we move forward with the webinar? His words would be, absolutely, no doubt about it. And Herb agreed that that is exactly what Steve would say. So with that, I am going to move forward with this webinar. And Herb, if you are able to stay on the call, please jump in at any time with any additional thoughts or ideas that you have as I present this overview.
Thank you, Jeff. I will.
So I'm gonna, good, thank you. So the first slide, I speak about some of the people who may respond more strongly than others to the stress of this crisis. And I want to emphasize that really this is one of those times where everybody is affected. This is not the kind of thing that some yes, some no. Everyone is affected. Everyone is stressed. Everyone is afraid. In many ways similar to, at least in my experience, how people lived through September 11th, where everybody was affected and everybody was stressed. Some of the people who are who may be even more strongly affected are certainly older people and people with chronic diseases who are at higher risk of developing COVID-19 and the negative outcomes of COVID-19. So certainly older people, people with chronic diseases. Another group are children and teens, especially younger children may not understand why their daily routines have changed, what's going on, why are they homesick when they don't feel sick, why are their parents so stressed. So that's another group. Another group are the people who are really dealing with, on the front lines, COVID-19. Doctors and other healthcare professionals are heroic in their work in caring for people, as are other people on the front lines, people who are working in groceries, in pharmacies, who are making delivery of food, obviously police, fire, all the ambulance drivers. So many people are, and those are people who are really under stress during this crisis. And the last group that I want to point out are people who have mental health conditions, all of the conditions, including substance abuse. This is a stressful time for everybody, and we need to be sensitive to the stress that that each of these particular groups may have. Nico, I want to go to the next slide, please. I want to talk a little bit about the different areas of stress and anxiety and fear that people may have. Time taking off and the potential loss of income. A lot of people are losing their job. This is a tremendous, tremendous stress for people. So not only are they worried about their health, they're worried about their job. It's stressful just doing things in everyday life, such as obtaining groceries and other items. So people are afraid about going to the grocery, afraid that they could catch something, bring something into their home. So that's an added stress day in and day out for people, and worried about will there be food in the grocery. And then finally, caring for children and others. People may be worried about their children. They may be worried about relatives who are older or who have potential risk factors for illness. If we go to the next slide, one of the areas of stress is we don't know how long this is going to work, and uncertainty adds to stress. We don't know how bad it's going to get, and that adds to stress. So that is for everybody, causes anxiety. The social isolation, loneliness, not being at work, working from home, is another area of stress, and I'll talk about the social isolation in a minute. The changing your routine, whether you're bored because you don't have anything to do with your regular activities, or working from home can be a stress. So there's a lot of things that really many people are experiencing. Many people are in the same boat. The next slide, please. In many ways, to me, this is the most important slide. First of all, social distancing does not mean social isolation. So while we're being careful and not going into groups, staying 6 feet away from people, that doesn't mean that you shouldn't be still socializing with people using technology. So whether it be phones, whether it be FaceTime, our adult kids have taught our parents how to use FaceTime so that they could speak with them, and so that grandkids and grandparents could be together, at least digitally. Reach out to friends. Don't be isolated. In fact, make an extra effort to reach out during this time. In addition, reach out to a neighbor who may need help. We know that helping someone else is also helpful to ourselves. So if you have a neighbor who may need assistance, may need help with groceries, etc., reach out to them, help them. Exercise is extremely, extremely important. And now people may have regular exercise routines that they cannot fulfill right now due to this, but they should maintain some level of exercise. I personally like to swim. Normally I would swim every morning. Obviously that's not happening now. I've changed my routine for a brisk walk outside every morning to maintain a level of my usual routine. People who do classes at various gyms are able to do it online now. So continue and increase exercise. We know the beneficial effects of exercise, not only on the body, but on the brain. We know that exercise is an impetus for neurogenesis, which is the growth of new brain cells and new connections between cells, in particular in an area of the brain called the hippocampus that is involved in anxiety and depression. So exercise is extremely important. Eat healthy. Maintain a healthy diet. Be careful with what you eat. If you're home all day, don't start eating snacks. Be careful with what you eat. And certainly alcohol, now is a time to be more careful than ever about drinking in moderation, not over drinking. Sleep is also extremely important. And with not having a normal routine, maybe working from home, that could affect somebody's sleep. It's important to make sure that you get enough sleep and that you have a routine that allows you to have a good bedtime routine so that you can unplug from the news and other things, social media, and get to sleep. And finally, this is something that I think research showed at the time of September 11th, consume the news in moderation. The current news cycle is very, very repetitive. So you want to stay informed. And I'll refer to some websites that might provide useful information to you. You want to stay informed, but you really don't want to have the TV on 24/7 with them repeating the news. It adds to stress. Next slide. It's important to realize that this social distancing really makes a big difference. And while it may be hard for people to do, will keep you and your family safe and will help decrease the risk of spreading the virus. It's important to create and follow a daily routine. So while your normal routine is out the window, as much as you can, develop a daily routine. The example I gave earlier of exercise in the morning, maybe you exercise at the end of the day, whatever it is you do, put together a daily routine. Pace yourself when you're doing things that are particularly stressful, such as perhaps going out shopping, or maybe dealing with work, or being concerned and reaching out to a family member or loved one who you're worried about. After doing something stressful, do something fun and relaxing, so that you don't build up that stress. Talk about your experiences. Don't hold it in. Speak to loved ones, speak to friends. They're all going through it. We're all going through this together. So don't hold it in. Speak to people about it. And when you step back and think about what are you afraid of, step back and say, okay, what can I do to decrease that fear? You're afraid of catching this? Well, you can be careful with social distance. You can be careful about washing your hands. There are things you could do to help relieve that fear. And I think it's important for people to keep in mind that while we're living through this now, it will pass. We had positive headlines of the improvement in China after what they've gone through. We will get through this also. Next slide. I want to give a few tips for working from home. As I said, a routine, a regular schedule is extremely important. Don't sit around in pajamas all day. Get dressed. Make it as normal as you can. Pick out a space that is your workspace at home, and make that, whether it be a separate room or just a separate area in a room, make that your designated workspace. Take breaks, and especially if you're able to, get some fresh air. Going outside makes a big difference. I know for me, it makes a big difference. As I spoke earlier, don't be isolated. Communicate with colleagues, socialize, be aware of isolation. If you have children, talk to your employer, to your boss, about the fact that you have kids in the house and how that may get in the way to some degree of your work. And I think people are sensitive to that. And obviously, if you're home with your spouse or partner, you can help coordinate that with each other. Next slide, please. I want to focus on some of the particularly vulnerable populations. Certainly, post-traumatic stress, people who have this condition, anxiety and depression, this could exacerbate that. Other psychiatric illnesses, as I said at the beginning. Unfortunately, people have lost a loved one to illness during this crisis. When I wrote this slide, I didn't know that I would be one of those people, and many of the people on this phone call would be someone who has lost someone that they love. These are all added stresses, and this is an even more difficult time to go through such a loss. And then the financial stress that people are feeling due to loss of jobs. Next slide. For people who do have a mental illness, it's very important that they continue their treatment regimen. And I want to emphasize the availability of telehealth. The rules about reaching your psychiatrist, other mental health professional, all health professionals have really changed, which allow for tremendous flexibility to reach out by telephone, by FaceTime, by other computer-assisted means to be able to get help. So for people who have a psychiatric illness, don't hesitate about reaching out to your psychiatrist, to other professionals for help. And if you're feeling that your symptoms are getting worse, that certainly is a time to reach out. Next slide, please. These are some sources that I think provides useful information and up-to-date information. The CDC, the World Health Organization, the American Psychiatric Association. So these are places to get reliable, up-to-date information. And the next slide, please. Some of the sources that we have at BBRF. Our magazine provides useful information. All of the issues of the magazine are available online. Please don't hesitate to go there to get information on topics that are of interest to you. Similarly, the Healthy Minds public television series is also available online, on demand. You can access it through our website, and it provides extremely important information for the lay public about a number of psychiatric conditions and research and treatment. And finally, I would encourage people to sign up for our e-news, which comes out once a week with updates about science, again, written for the lay public, so people can be aware of some of the discoveries that are taking place that are extremely important. Next slide, please. Being anxious at this time is a completely normal response to stress, and I can't emphasize that enough, that for anybody who's feeling anxious, if anybody said to me they don't feel anxious, I would be concerned, because everybody's feeling anxious. If your anxiety or loved ones get to the point that you're having difficulty in your daily functioning, that would be a time to reach out to your physician for help. And you can do so, as I already said, using technology or a plain old-fashioned telephone to get the assistance that you need. And don't be shy about doing that for yourself or for a loved one. That is the formal presentation. We have a number of questions that have come. But before going to that, I want to ask Dr. Pardis, Herb, is there anything that you would like to add, any suggestions that you want to add to what I've said?
No, I think you've stated the case pretty well. I think that one of the exciting things that's happening is that there are increasing diversity of scientific efforts and some possibilities of real both discoveries and also treatments. And it's getting more and more enthusiastic. We canvassed about 72 labs, 82 labs actually, and asked them their general mood, and it had been somewhat down a bit a few years ago, and it's up. People feel excited about the various new technologies we're developing. It's widely diverse, tackling all the problems, and brain behavior is really intending to play an ever stronger role in bringing some relief to these diseases. So, Jeff, thanks for doing this, and I thank everybody for helping support this extraordinary organization.
Thank you, Herb. I'm going to jump to some of the questions that people have asked. The first one that is, I think, extremely important, and I think that it relates to a number of people, is a concern about getting medication when a person requires blood drawing for refills. And this refers to the use of a medicine called Clozaril, which is a very effective medicine for people with schizophrenia and other psychoses. And it requires blood drawing. So thank you for asking that question. It's important for people to know that the regulations around the blood drawing have been adjusted during this crisis. So if you are receiving Clozaril and or other medicines that might require blood monitoring, reach out to your psychiatrist and speak with him or her, because the requirements are being adjusted, so you will be able to continue to get your medicine and be monitored safely. So I appreciate that question and want to emphasize that answer. I have a question, a sort of a big picture question that asking, will there be an increase of mental health disorders during this pandemic? And hello?
Yes, go ahead. We can hear you.
Do you hear me?
Yes, we
okay.
can.
Was there a time? Did you hear me when I asked the last question?
Yes, absolutely. Please.
Okay, good. So the question is about potential increase in mental health disorders during the pandemic. It's a great question. We don't know, but I think that certainly we are aware that increase in stress can increase people's risk of developing anxiety, depression, other conditions, both people developing it for the first time and people who already have it having an exacerbation of their condition. So I think that we all need to be sensitive to the fact that there may be an increase in people needing help and hopefully in people seeking help, because just because someone needs it, they don't always seek it. And I think it's incumbent upon all of us to make sure that if you have a friend or a loved one who you see having a change in their level of functioning over this period of time, to encourage them to seek help. And they could do it over the phone. And I would say the first step would be to speak to their primary care physician to let them know, him or her know, what's going on, and then receive a referral, if need be, to a psychiatrist or other mental health professional for assistance.
Jeff, this is Herb. If I could just add the fact,
yes.
If I could add the fact that your reference to telemedicine is very valuable. We are finding that many people are being helped, particularly people who are at a distance from qualified psychiatric help. But telemedicine is something that people should explore if they live at a distance. It makes it easier. It doesn't mean they have to travel to particular organizations, but it's been particularly successful in the treatment of psychiatric disorders.
Good. Thank you, Herb. And I'm going to ask you, Herb, there's been there are a number of questions just about the status of hospitals right now. And I know with your leadership, a lot has been done to be able to accommodate the needs. Could you say a little bit about what's going on with the hospital and the hospital systems?
Well, there's been tremendous demand. People are coming in large numbers. The numbers, as you see on the television, keep climbing. Our hope is that as people comply with the notion of keeping a distance from other people, as they use methods of sanitation, hand washing, all the substances that eliminate the possibility of infection, that they will do much better. And people staying at home, where I know you're functioning at a remote site rather than at your office, so are we. Many of the hospitals are. Now, the hospitals are there for people who develop symptoms that seem pretty intense. And the attempt is to try to focus attention on those people and not have too many of the people who might have minor conditions, minor symptoms to flood the hospitals. The hospitals are functioning very effectively. They're busy as hell. One of the problems they're trying to do is solve the problem of resources and supplies, and it's getting better. And they're trying to catch up with this thing and start to bring it under control. And in some places, you're seeing a slide down somewhat of the frequency of new cases, which says that the idea of social distancing and keeping in your homes rather than going out in large crowds may be having some success. At the same time, there are a tremendous number of laboratories working on treatments and vaccines, and so our hope is that they will bring to us some additional help. The other thing that's very good is new efforts that people have just generated for making the diagnosis of positive situation with regard to the virus much more easy to detect and quicker. All of those things should help. So they're working hard, but it's true there's a tremendous demand.
Good. Thank you, Herb. There's a question about students, which I think refers to children, teenagers, even young adults, and who may have a psychiatric condition. Do they need extra medication during this time? I think it's a very good question, and because it shows a sensitivity to the fact that they very well may need added treatment. So I would say, depending upon how that young person or any age person is doing, this is the time to increase the outreach to their psychiatrist or other mental health professional, make sure that they're being monitored closely, and if there is a need for a change in their medicine, in addition to medicine, or more talk therapy, whatever it is, they can make that intervention right away, and that can make a big difference. You want to nip these things in the bud. So if somebody's starting to have symptoms, for instance, not able to sleep, or not able to eat, then you want to really immediately intervene and not let it get even worse. We have a question about a very important topic, which is suicide. And the question is, with the social isolation, will there be a spike in suicide rates? It's a very important question. As people are aware, the suicide rates are extremely high in our country. Before this happened, more people die as a result of suicide than homicide in the United States. And as I said earlier, the stress is something that can add to the risk of a psychiatric condition and certainly his risk for suicide. So I would say,
could I comment? Could I comment on that?
Yes, please do. Yes.
Look, I think that one of the things we should all be doing is being in contact with many of our close friends and family, because isolation and the feeling of being alone are threatening things to people. So one way of solving that, since we have to stay apart, is to keep connected by whatever means we have, talk to each other, particularly monitor or keep aware of how people who may be feeling stress or we know have been having some difficulty, be alert and available to them and talking to them, because all of us should play some role in observing our friends and family in order to give them the feeling they're not alone and that they can go. There's somebody they can go to if they need it.
Thank you, Herb. Extremely, extremely important advice. We've had, I think, questions, some from people who are healthcare providers and some from people who are concerned about healthcare providers who receive treatment, about the stress on the healthcare providers and what's being done to support them. Herb, I'm going to throw this one to you and see if you could give a little bit of information.
I think one of the impressive things is that so many people have come forth. Hospitals, health centers, clinics, doctors' offices are all receiving offers of help from very, very many people who want to help, whether it's by voluntary work. An example, for what it's worth, the hospital with which I'm associated has had something in the neighborhood of 70,000 people call to volunteer help, because we need enough person power to do it, to help in the right way. But many of the private institutions, there are businesses that have done all kinds of things to give some benefit to people in difficult times. And what's nice to see and hear about is the feeling of generosity or cross concerns. Really, it's pervasive, I think, throughout the country. And that's one hopeful sign in what is a rather extraordinarily difficult situation.
Good. Thank you. We have a question related to severe bipolar disorder and a family member who has that and the effect upon that illness. And I think that goes for many other illnesses, what to do. And I think the guidance, again, is now is a time more than ever to make sure that person is engaged in treatment, reaching out to their psychiatrists, other professionals, taking their medicine, doing everything possible to be careful, because this is a stressful time. So we want to really help everybody get through this as best as possible. Herb, do you want to add anything to sort of the guidance for people who have loved ones or they themselves have significant psychiatric illnesses?
I think you said it well. If we know that we have friends or family who have a psychiatric problem, I would want to be in touch with them. I would keep contact with them. I would make it clear that they can call me anytime. And I would also, if they have, given they have people who are health providers who are helping them, to feel they can contact them. This rather remarkable period of isolation and people staying alone is a additional challenge. And for any psychiatric illness, in fact, for all people, it has some stress. So I think the way to correct it is to have as much cross conversation and contact as possible.
Good. Thank you. We received a number of questions, and I've had people reach out to me just personally about really the operations of research. And I want to let everybody know that beginning a couple of weeks ago, we were able to have the staff of BBRF work remotely. So we are moving forward with our operations. We are receiving the applications from scientists for the Young Investigator Awards. We're coordinating that with our scientific council. Our staff is safe working from home. So that's moving forward in a very positive way. And I wanted to ask Herb, if, in speaking with members of the research community, your sense of how research is progressing during this time, how labs are able to continue to work, and what's happening in terms of the research in general, above and beyond, obviously for COVID, but just research in general being able to continue during this time.
Well, I think it's challenging. And I think, there are often trials that people are undertaking, and it's not as easy to make contact with patients who may be in the trials. The operations of any enterprise, business, non-business, science, non-science, is affected by the fact that people don't have the intimate contact of being in one center or office or the like. But we have remarkable people in this field, and they find ways of coming around it one way or the other. It's one of the reasons I was emphasizing the telemedicine, because that compensates. But there's no question but there are challenges, and research will feel the stress that this unfortunate situation has generated.
Good. Thank you. Thank you. Our time is coming to an end for this. I want to thank you, Herb, for joining today. It really has been extraordinary to have you as part of this webinar.
I'm happy to be with you. Look, it's become apparent that psychiatric conditions are unfortunately very widespread. If anything, there's been an increase in the last few years. And I think what is heartening is that more and more general institutions are recognizing, both government and non-government, how important this is. So that means more work, more treatment, more availability. And everybody on this call, I'm sure, is a supporter, should be arguing for an adequate enough support for the programs, the people who are suffering from it, the providers. I think it's right now we are in a unusual time, and one which comes as there's been a pickup on the appreciation of how important psychiatric disorders are. So, Jeff, thank you. Thanks for BBRF, all its supporters and the staff. There's a wonderful family that's trying to work together here to solve this problem. And why don't we add the notion that as we do this, somewhere, somehow, Steve and Connie are smiling because they know everybody is carrying out the very effective efforts that they have so long championed.
Thank you, Herb. That sentence just put a smile on my face as you said it. And I certainly can have a vision of that, so thank you. I also want to thank everybody for joining us. 100% of all donor contributions for research are invested in our grants to scientists. All of the research we fund is made possible through supporters like you, so please consider making a gift by visiting our website, bbrfoundation.org, or call 1-800-829-8289. If you leave a message, we will get right back to you. This webinar has been recorded. If you've missed any portion of the presentation or would like to share it with family and friends, please visit the events and webinar page on our website. I hope you'll join us again in 2 weeks when our regularly scheduled webinar with Dr. Stephen Marin, Distinguished Professor in the Department of Psychological and Brain Sciences at Texas A&M University, will present Can Traumatic Memories Be Erased? This webinar will take place on Tuesday, April 14th at 2 p.m. Eastern Time. Once again, thank you for joining us. Stay well and stay safe.